Dr. Currie here. Did you know that I have met, worked with, and treated many patients through the years who have a condition in their spine called scoliosis? Now, it's been a pleasant surprise that this has developed over the years, because whenever I first opened my clinic, close to 20 years ago now, I did not plan on that happening. But because so many people who have scoliosis, because they suffer greatly, they have a lot of neck and back pain or sciatica pain or other pains that come along as a result of the scoliosis. And because the surgical interventions that are out there or the other procedures, so many of them still end up in a great deal of pain after they've had those procedures done, they have found their way to me through the years. And so now hundreds, I don't even know, it's been a lot of people that I've worked with who had scoliosis. And one of the things that I always discuss with people who have scoliosis is that whenever you have number one, let's talk about what scoliosis is, okay? Scoliosis, for those of you who don't know, and if you have it, I'm sure you know, but for those of you who don't know, scoliosis is when there is a curvature in the spine. So if you look at someone from this view, the spine should go straight down, okay? Vertebra, 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 all the way down. But when there's a scoliosis, there will be a side curvature. Now, what most people will have is they will have what's called a double major curve. People who have scoliosis, they'll have a curve in their mid to upper back, and then the body compensates for that, and they'll develop a curve in their low back. Or maybe they develop the curve in the low back first, and then later the curve up above develops. But the reason why that happens is because the body is an amazing adaptive organism, okay? So what happens is when you have a curve in one area, say your thoracic spine, for example, well, your brain says, hey, you know what? When I walk, I need to have my head straight. I don't want to walk around with my head like this all the time. So the brain will send the signals to the muscles in the back or the neck and then work that curve out so that it adapts, so that ultimately when someone walks, for the most part, their head is going to be straight, okay? Now, with scoliosis, what happens is with that curve, okay, you'll see that on the inside of the curve, there will be a lot more pressure on those discs and also on the joints on that side than on the outside of the curve. So then people will start to develop a lot of degenerative disc disease and pains and arthritic pains and those kinds of things as a result of that increased pressure that's there. And so I've had a lot of fun over the years treating those patients and helping them. Does it get rid of their scoliosis? No. And I tell all of them that before they start. It's just like whenever I talk with a patient who has a lot of arthritis, I'm like, look, the arthritis that you have in your spine today, when you start this program, is going to be the same arthritis that you'll have in your spine when you finish the program. But if you're hurting a lot less, and if your quality of life is greatly improved, and if you're happy, I'm happy, then we win, okay? And so that ultimately is what it boils down to. People who come in, I tell them, look, if someone ever tells you that they're going to get rid of your scoliosis, you might want to think about that situation, because it doesn't really usually happen that way. A lot of people tell a lot of people a lot of different things, okay? And so it's important to understand, in my opinion, in 2023, whenever someone has scoliosis, most of the time they're going to have scoliosis. So then it becomes, what do you do about that to maintain or improve your quality of life? And ultimately, that's what I work to do with my patients. And so ultimately, if you can open up those discs, take pressure off the nerves, help the hydration of the discs, help improve the health overall. If someone needs some functional medicine work, which I also do a lot of that, where I work with patients who want to improve their health. We do a lot of lab testing, looking for inflammatory markers, anything that can reduce the overall inflammation of the system from head to toe, so that then in turn someone can be much healthier in the long run, and then just slow down that degenerative process can go a long way